The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Brumell, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you on the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' miraculous recovery stories. Today's show will begin with an interview with my American Medicine Today radio co-host Ethan Euchre and Dr. Christian Dreschen, founder and director of Clinique of Plastic Surgery in St. Petersburg, about CoolSculpting, a non-invasive alternative to liposuction. Next, we'll hear from Master Sergeant Michael McDonald, one of our Help for Wounded Warriors recipient who underwent a complimentary Bonati spine procedure with world-renowned orthopedic surgeon and founder of the Bonati Spine Institute, Dr. Alfred Bonati. We'll hear about Michael McDonald's remarkable recovery from him personally and the medical staff that assists Dr. Bonati in treating these patients in our Back to Life segment. To follow up, we'll speak via Skype with retired soldier Lieutenant Colonel Steve Russell, who is currently running for the U.S. House of Representatives in Oklahoma, about the troubles that are continuing to plague the Veterans Administration. Then we'll speak with Dinesh D'Souza, New York Times best-selling author and critically acclaimed filmmaker of America, Imagine a World Without Her. We interviewed him from the News Radio 970 studios for our radio program, American Medicine Today, which can be heard Saturdays at noon. We'll speak with Dinesh about the movie that questions the shaming of the United States through revisionist history, lies and omissions by educational institutions, political organizations, Barack Obama, and other progressives to destroy America. Finally, we'll hear from Florida Senator Alan Hayes, who is trying to get this movie into our classrooms by introducing legislation to make it required viewing in over 1,700 Florida schools. Introducing our first guest is radio and program executive producer and co-host of American Medicine Today, Ethan Euchre.
Thanks, Kimberly. Every Saturday at noon, we are joined by interesting guests who shed light on the growing concerns many Americans have about their medical care. The patented Bonati spine procedures are leading the way in minimally invasive spine surgery exclusively performed at the Bonati Spine Institute. Now, a recent 7.5-year survey shows a patient satisfaction rate of 98.75%. Dr. Bonati dramatically changed the way conventional spine surgery was performed. Now, our first guest is Dr. Christian Dreschen, board-certified plastic surgeon. He is also the founder and director of Clinique of Plastic Surgery in St. Petersburg, Florida.
And we sat down and talked to him about CoolSculpting, a new non-surgical alternative to liposuction. We're here with Dr. Dreschen, and he's a board-certified plastic surgeon and founder and director of the Clinique of Plastic Surgery. He's here to talk about what's called CoolSculpting. So Dr. Dreschen, explain what CoolSculpting is and how it can help those that don't want to undergo surgery necessarily, but they want to look more in shape.
CoolSculpting is a non-invasive liposuction, basically. So it's based on the principle that if you freeze the fat, the fat cell will die. So they picked exactly the right freezing tool so that it doesn't damage your skin but freezes the fat. The major advantage of that is obviously there's no surgery, there's no downtime. I mean, you can come from work and go back to work right after that. It's a great procedure because for the people who work, they can come into the office 1 hour later or an hour and a half later, leave back to work, and really there was no sign of having had a procedure.
It's very minimally invasive. I love the feeling of it, knowing that you don't have to go through medical procedures, anesthesia, any of that. You just lay here for an hour and you'd be done. You could take a nap.
While I was having the treatment, I just took out my iPad and finished some work, talked to my husband.
How many treatments do you feel is necessary for someone to receive optimum results, at least in one area?
Yeah, if you talk about one area, I mean, one area in general means two areas because you go one hip and then obviously you have to do the other hip.
Correct.
But so one treatment is enough to see a substantial reduction. Some people come with multiple area, obviously. Therefore, every single area is basically 1 hour of treatment. But once again, the advantage is that there is no downtime short of that little immobilization for 1 hour.
Correct.
You don't have to go to a hospital, you have to be put asleep, you don't have anything that bleeding and this and that. And for some people, especially people that are very sensitive to the idea of having surgery, is a perfect method, yeah.
And no scarring.
No scar.
Now, how long from the time you have the procedure to when you actually see the results? Is it something like that immediate?
No, it's about a month. It takes time for actually the fat cell to break apart. Having been frozen, they break apart and your body scavenge all that thing and basically get rid of it. So it takes about a month to see the result. Yeah.
And who is the sort of ideal candidate for cool sculpting? You can't treat someone who's morbidly obese.
No, absolutely not. I mean, the ideal candidate, somebody who was about a normal weight, essentially what we consider a normal weight, but as a role. I mean, for men, it's usually the love handle. For women, it could be the love handle. It could be sometimes a place like the inner thigh, some be a place like the outer thigh.
And you're saying the application takes about an hour long?
About an hour. It's about the whole process is about an hour, about 45 minutes to an hour.
And so, what happens to the fat after it's frozen? And it's not uncomfortably cold having that on your skin.
It warms up
freezing the
fairly
fat?
quickly. So what we do right now, after completion of the treatment, we do a massage of the area, and the area almost feel like a piece of cold butter. So you massage it in. As you massage it in, it actually improves the damage to the fat and improve the result.
It's great. It doesn't hurt at all. I've been here almost an hour just on this side.
When I first had the applicator applied, I felt a little bit of tugging and pressure, but that soon went away. In 5 to 10 minutes, I was numb. Honestly, the treatment was amazing. I didn't really think it was going to be so easy, and I definitely do it again.
And so, how does the body get rid of that fat?
Well, the
after
body
it's dead?
basically is a bit the same idea as defreezing a piece of meat from the refrigerator. If you let it breathe, you see it bleeds out because a lot of the cells explode. And basically, as a fat cell explode, by definition, they are dead. So your body scavenge all the debris of that fat and get rid of it.
But it's definitely not anything you'd want remotely near the face.
Yeah, they're actually doing an applicator now that can be used for the neck as well.
It can?
So yeah, so there is a variety of applicator that are in the design process now to respond to the different area in the body.
And so, how permanent is this fat? Because I read somewhere that lipid cells are sort of, they expand as you add more lipid to them, but the actual fat cells, they're always going to be in your body.
Well, except in this case, they no longer expand because they've exploded. So they no longer
destroyed them.
They're gone. They're pretty much gone. So basically, you do the same thing when you do liposuction. When you do a liposuction, you extract the fat cells. So obviously, you can gain weight in another place, but the spot itself where the liposuction was performed will not change. It will not. It's permanent. So the same thing applies for the cool sculpting. And once you have destroyed the cell, they're no longer viable, and therefore they cannot expand anymore.
So if somebody was interested in the cool sculpting procedure, what are the steps they would need to take?
Well, the first step would be eventually to call us at the Clinic of Plastic Surgery and then ask to speak to the person in charge of a cool sculpting program, and she can then give you all the information, including try to accommodate your time and be put on the program. So it takes very little. Technically, we don't need any lab work. It's basically applicable for anybody in any kind of medical condition because there's relatively no contraindication to cool sculpting.
And how could they contact you?
Well, you can contact us by phone, which is 727-592-0991, or on the website cliniqueps.com. Clinique is spelled like Clinique Cosmetic. so clinicps.com.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All of our surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeon more access to their patients and allows you to go home the same day. We'll be right back to hear from Bonati Spine Procedures patients benefiting from our Help from Wounded Warriors program in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.